What do you think your system has to pay for electronic health records? Hey everybody, it's John with Contract Diagnostics, and I wanted to shoot just a quick episode because I read this article and I thought, I wonder how much the physicians know about this expense that is supposed to make your lives so much easier. Now we know electronic health records, you can buy multiple different brands, multiple different types. You can have kind of a cheap version, you can have a really, really fancy version. Just like anything else in life, there's good, there's better, and there's best. We do know that this is mandated now, so every physician will be utilizing an electronic health record. The old ways are long gone. That's been passed for years and years. But I read this article that was published last month, and the numbers in here were astonishing. And I'll read straight from the document. According to financial documents published in December, Cleveland-based University Hospitals expect its Epic installation to cost $400 million. Now that seems like a lot, but their initial input thought it was going to be $600 million. So they're actually saving money on the cheap price of only $400 million. It talks about other organizations paying $25 million or $900,000 or $65 million. So know that these are significant input costs for your employer. Now I bring this up not because this is something that you guys will end up paying for, directly anyways, but it's, I think, one of the reasons where we've seen the migration of private practice physicians into hospital employed groups. And one of the reasons is because of some of these costs. Now, a great system can utilize a lot of technology and increase billing. It can increase the physician's RVUs. So it is important and impactful to your practice which type of electronic medical records is offered by your employer. I do think that on a site visit or on an initial phone consult that you're having with a physician that you're currently interested in, I think it's a very good question. What type of electronic health system do you have? I think it's important to understand that many different frames out there that you should know what you're comfortable with, what you've used in the past. I think a physician, as they go about looking at what their sales points are for the position and why they should be paid top notch, I think one of those things is making sure that you are very familiar with many different electronic health record systems, and whatever it is that they use, you'll be able to integrate quickly. You've shown the ability to adapt and to change based on your employer's needs of a certain system over another. And if there's a new integration at your system, I encourage you to take full advantage of helping lead that charge and show by example how you can adopt a new technology. I think that's going to be of the utmost importance moving into the world of AI and how different organizations will be building in artificial intelligence into your position. But I think it's important to understand that these are upfront costs that an employer does take, which is again why I think a lot of physicians are going from private practice into hospital employed over the past decade. But I also think it's important to understand that even though these input costs are something that the employer takes on, it's still important to negotiate your compensation. So just because the employer has these input costs doesn't mean that they don't do it because there's a benefit to them. So they realize if they spend $500 million on an electronic health record system, sounds crazy when you say it that way, they realize that there's an upside. So hopefully these things are making you efficient, they're making you utilize proper codes, and they're increasing billing for the hospital, which of course is where their investment comes from. Hopefully they're making your life easier. If it's not, I think the hospital would appreciate to know that their massive investment is not making the physicians' lives easier, more efficient, or more conducive to patient care. So I bring this up because I think it's important to know when you're talking to the employer about your compensation and you're negotiating, it's a good thing to know where they're coming from. It's important to understand they do have these costs, and they do have lots of things that they have to pay for outside of the physician's salaries. But we all know that without the physicians, there is no revenue for a hospital system. So I think we understand where they're coming from, that these are costs that they need to incur, but also that we need to maximize your compensation. And that's what we're here for at Contract Diagnostics. So I share this information as an interesting FYI. It was interesting to me when I read it. I knew they were costly and expensive, but I didn't know that major systems. Again, this is a Cleveland system, a lot of physicians there, but $500 million is a lot of money for any technology, regardless of what it does for the system. But I thought it'd be interesting for you guys to hear, but also a good opportunity to say, appreciate the frame of your employer. Understand they do have these costs, but again, have an open, honest, and effective communication with them around your contract, your compensation, and how you can best maximize it. If we can help with anything, reach out to us at Contract Diagnostics. We'll always be here.